Cats are masters at hiding pain. They are descendants of solitary hunters. In the wild, showing weakness could mean danger. This instinct to mask discomfort can make it tricky to know when our feline friends aren't feeling their best. One such condition that often flies under the radar is feline lower urinary tract disease, or FLUTD. Don't let the long name fool you. This is a serious issue that can quickly escalate if left untreated. FLUTD is a blanket term. It encompasses a range of conditions affecting a cat's bladder and urethra. These are the very important parts that control urination. Because our cats can't tell us when they're hurting, it's up to us to be vigilant. We need to recognize the subtle signs that something might be wrong. Early detection can be the difference between a minor inconvenience and a life-threatening situation. Changes in litter box habits are often the first and sometimes only indication that something is amiss. Is your cat straining to pee? Are they going more frequently than usual, or maybe even having accidents outside the box? These are all red flags that warrant immediate attention from a veterinarian. Let's break down FLUTD a bit further. Imagine the urinary tract as a plumbing system. You've got the kidneys, which filter waste products from the blood to create urine. Then there's the bladder, a storage pouch for the urine until it's ready to be expelled. And finally, the urethra, the tube that carries the urine out of the body. FLUTD is like a clog in this system. Something is preventing the normal flow of urine, and that's when trouble starts. This blockage can cause discomfort, pain, and even life-threatening complications if left untreated. It's like trying to force water through a kinked hose. It's just not going to end well. Now here's the thing about FLUTD. It's not a single disease, but rather a group of conditions that share similar symptoms. Think of it like a big umbrella, and under that umbrella are various culprits causing all the trouble. We'll delve into those specific culprits in the next section. So, we know that FLUTD is like a plumbing issue, and we know something is clogging up the works. Now let's shine a light on some of the usual suspects causing all this urinary mayhem. One of the most common culprits is feline idiopathic cystitis, or FIC for short. Idiopathic is just a fancy way of saying we don't know the exact cause. FIC is a bit of a mystery, but we do know it involves inflammation of the bladder. Imagine your cat's bladder getting irritated and swollen. Ouch, right? Another common offender is urinary tract infections, or UTIs, which are caused by bacteria wreaking havoc in the urinary tract. These infections can be painful and need prompt treatment. Then we have bladder stones, which are like tiny irritating pebbles that form in the bladder. These stones can block the flow of urine and cause a world of discomfort. Urethral plugs are another common culprit. These plugs are made up of a combination of minerals, proteins, and inflammatory cells, and they can lodge in the urethra, effectively blocking the flow of urine. And finally, we have tumors and anatomical defects, which are less common but still important to consider. Tumors can grow in the urinary tract and obstruct the flow of urine, while anatomical defects are present at birth and can make cats more susceptible to developing FLUTD. Cats are masters at disguising pain, but there are subtle signs you can pick up on if you know what to look for. One of the most telling signs of FLUTD is a change in litter box habits. Your cat might start straining to pee, making pained expressions, or even crying out. They may also urinate more frequently than usual, producing only small amounts of urine each time. Keep an eye out for accidents outside the litter box, as this can be a sign that your cat is having trouble controlling their bladder. You might also notice blood in their urine, which will give it a pinkish or reddish tinge. Another common symptom is licking their genital area excessively, trying to soothe the discomfort. If your cat exhibits any of these symptoms, it's crucial to seek veterinary attention immediately. Don't wait for the problem to worsen. Early diagnosis and treatment can make a world of difference in the outcome for your feline friend. When you bring your cat to the vet with suspected FLUTD, the vet will become a detective, gathering clues to pinpoint the cause of the problem. The first step is a thorough physical exam, feeling your cat's abdomen for any abnormalities and checking their overall health. Next up, the vet will likely recommend a urine test. This is like peeking into the microscopic world of your cat's urine to look for signs of infection, inflammation, crystals, or blood. A urine culture might also be performed to identify any bacteria present and determine the best course of treatment. Depending on the suspected cause, the vet might recommend additional tests, such as blood work, X-rays, or even an ultrasound. Blood work can reveal underlying health conditions that might contribute to FLUTD, while X-rays and ultrasounds allow the vet to visualize the urinary tract and look for any blockages, stones, or tumors. Once the vet has identified the underlying cause of FLUTD, they will recommend a tailored treatment plan. For bacterial infections, a course of antibiotics is usually the first line of defense. Pain relief medication might also be prescribed to help your cat feel more comfortable. If bladder stones are the culprit, the treatment will depend on the type and size of the stones. Some stones can be dissolved with a special diet, while others might require surgical removal. Urethral plugs can sometimes be dislodged by a veterinarian, but in some cases, a catheter might be necessary to drain the bladder and restore normal urine flow. In cases of FIC, the focus is on managing the symptoms and reducing stress, as the exact cause is unknown. This might involve dietary changes, stress reduction techniques, and in some cases, medication to help control inflammation and pain. Remember, following your vet's recommendations closely and completing the full course of treatment is essential for a successful outcome. Prevention is key to safeguarding your cat's urinary health. While not all causes of FLUTD are preventable, there are steps you can take to significantly reduce your cat's risk of developing this uncomfortable and potentially dangerous condition. One of the most important things you can do is to ensure your cat stays well hydrated. Think of water as a flushing agent for their urinary system, helping to prevent crystals from forming and flushing out any potential irritants. Encourage your cat to drink more water by providing fresh, clean water sources throughout your home. Consider adding a water fountain to entice them to drink more. Diet also plays a crucial role in urinary health. Feeding your cat a high-quality, balanced diet that is specifically formulated for their life stage and health needs can help maintain a healthy urinary pH and reduce the risk of stone formation. As cat guardians, we play a vital role in our furry companions' well-being. We know them best and are often the first to notice when something seems off. FLUTD is a perfect example of why being attuned to your cat's normal behaviors, especially their litter box habits, is crucial. Early detection of FLUTD can be life-saving. The sooner you recognize the signs and seek veterinary attention, the better the outcome for your feline friend. Remember, what might seem like a minor issue, such as straining to pee or going outside the litter box, could be a sign of something more serious brewing beneath the surface. Don't hesitate to contact your veterinarian if you notice any changes in your cat's behavior, no matter how small they may seem. It's always better to err on the side of caution. Caring for a cat is a lifelong commitment, and part of that commitment is being proactive about their health. Regular veterinary checkups are essential for catching potential health issues early on, including FLUTD. During these checkups, your vet can assess your cat's overall health, identify any potential risk factors, and advise you on preventive measures. Think of your vet as your partner in your cat's health care. They are there to guide you, answer your questions, and provide the best possible care for your furry friend. By working together, you can help your cat live a long, healthy, and happy life, free from the discomfort and potential dangers of FLUTD.